congratulate the member for Milton Keynes Central for securing this debate. This year, as both Gavi, the Vaccine Alliance, and the Global Fund conduct their funding replenishments, it is more important than ever that we consider the indispensable value of their work, both for Britain and for the world. Since its inception at the beginning of the millennium, Gavi has immunised more than 1 million children and saved in the region of 20 million lives. The UK was one of the Alliance's founders and have since constituted the largest single sovereign donor. The Global Fund, in its short existence, has succeeded in driving down the death rates across AIDS, TB and malaria by 61%, saving 65 million lives. That is close to the entire population of this country and would not have been achieved without British support, which manifested most recently in a £1 billion pledge to the Global Fund's 7th replenishment. This money is likely to avert around 1 million deaths. We have made so much progress, eliminating many diseases in some countries and reaching the edge of success in others. However, the work of Gavi and the Global Fund is being placed at risk by short-sighted cuts to international development spending. President Trump has gutted USAID, shattered the fund which fights HIV and AIDS, and is also poised to eliminate much American funding for global immunisation efforts. And following this playbook, this government has now decided to slash British development spending to 0.3% of our GNI, its lowest level this century. I still remember, as do many others, the optimism of the last Labour government, who pledged to make poverty history and who funded Gavi and the Global Fund when they were created. This government has rejected so much of the proud 1997 legacy, and they must not do so when it comes to global health. So I hope they put money behind their pledge to prioritise global health and vaccination that they have asserted. There are so many strong and resonant moral arguments for Britain. But at the same time, the fight against disease serves concrete British interests. And the war against infection is currently facing an alignment of factors that make victory even more challenging than ever. Climate change is amplifying disease risk. Higher temperatures are opening up regions to mosquitoes, and the incidence of dangerous weather conditions is on the rise. Pakistan's catastrophic 2022 floods, for example, have since led to an almost 7 million additional malaria cases. And at the same time, the disturbing spread and intensification of conflict across the globe is impeding efforts to treat and prevent disease. Increasingly, civilian populations are being deliberately cut off from aid, and healthcare facilities are not only being disrupted, they are being targeted. And in consequence, we are seeing the return of once controlled diseases like polio and upticks in those like cholera, which emerge from degraded sanitary infrastructure. Why does this matter for Britain? Because, as we have heard, disease does not respect borders. Since COVID, all of us are only too aware that disease can reach our shores, putting both our NHS and our health security at risk. And resistance, particularly in strains of TB and malaria, is an increasing threat. Both Gavi and the Global Fund are working on the development and deployment of new generations of TB vaccines, even in the face of these new headwinds. Existing interventions for fighting malaria are also seeing their efficacy decline in the face of insecticide and drug resistance. Better, sharper tools have been developed. The challenge is now getting them where they are needed. And for that, we need the Global Fund. I will give way.
Iqbal Mohammed.
Honourable Member give way. With my work before I came into this place in pharmaceutical industry and the whole safety, efficacy and regulatory compliance, does the member agree with me that the leadership role that the UK has played to date is not just limited to financial contributions and support, but it ensures that the vaccines that are rolled out in third world and low to middle income countries are as safe as they can be?
I absolutely agree with my honourable friend, and I was about to come to the trade benefit, the economic benefits of Gavi and the Global Fund. There are economic benefits. A study of Gavi-supported countries showed that through healthcare savings alone, each dollar spent returns 21. When wider social benefits are considered, this rises to 54. Accounting for trade opportunities for Britain, healthcare savings and other economic boosts, both Gavi and the Global Alliance have generated value equivalent to hundreds of billions of dollars. So neither charity nor a giant cash dispenser in the sky, but instead a deposit account for the security, health and soft power of our nation.
Will the honourable member give way?
I will give way.
I'm grateful to my honourable friend, and she's making an excellent speech. On that point about soft power, China tends to deploy its vaccines in accordance with its regional influence and global standing, rather than on the basis of where there is the greatest need. Does she share my concern that the withdrawal of Western funding from vaccine alliances could clear the way for China to engage in further vaccine diplomacy?
I thank my honourable friend for a point very well made. I have consistently said that cuts to our international aid and development spend creates the space for rogue actors, including China and including Russia, to move in. Now, I know the government like polling, so I am happy to share that the British people understand the value of spending on vaccination. Recent Adelphi polling found that 70% of our people believe that supporting global vaccine access benefits Britain. But it is not only about British funding, it is also about British leadership. Our expertise and our convening power have been continuous assets for Gavi and the Global Fund. I fear that the government's aid cuts have put this leadership at risk. So the government must work to reverse this trend. This year, along with South Africa, Britain will be hosting the Global Fund's replenishment efforts. As host nation, other countries and NGOs will look to us for leadership to make a significant pledge. And I hope we will step up. I want to say in closing a little bit more about what Britain's support means to others. I recently met with Botswana's Health Minister and the Special Ambassador of the African Leaders Malaria Alliance. They shared with me their pride at how the progress that has been made on AIDS, with related maternal mortality falling by 80%, and on bringing malaria to the threshold of elimination. They told me that the work of Britain in this success is always felt very warmly, and that it ties the two people and is an expression ultimately of humanity. They told me that the collaboration fuels trade and partnership. The Minister and the Ambassador worry so much that progress and so much investment risks reversing in the wake of a global aid retrenchment, including by Britain. They do not expect global support to last forever, but wrenching it away before countries have fully built up their own capacity is a destructive mistake that they and we will pay for. So, from these benches, I encourage this government to reaffirm our commitment and pledge generously to Gavi and the Global Fund. And I encourage the government to reaffirm our commitment and leadership in aid and reverse the savage cuts to our aid budget. This still new government must decide the Britain they want to deliver. Our wish is one bestriding the world stage, a development superpower, consolidating our massive progress and gains, firming our friendship, acting with compassion while delivering for our own people, security from conflict, disease, and controlling upstream migration to these shores. The space for leadership is now vacant, and I urge the government to fill it.
Hear, hear.